organized medicine has to hear you. I stand there, and actually I have been to Washington and across the country representing an organization called the Coalition to Protect Patients' Rights. That coalition is all about patient care. It is supported only by private funds. It is not party affiliated. I hear your frustration. I see it all over the country, not only from doctors, but from patients. Patients who want their doctors to work for them. Patients who are tired of having not just insurance companies, but the government run interference patterns for what we know are patients' needs. I hear your frustration. I see it all over the country, not only from doctors, but from patients. Patients who want their doctors to work for them. Patients who are tired of having not just insurance companies, but the government run interference patterns for what we know are patients' needs. That said, we had a presentation by a doctor here who knows that the real cost of health care is not what people pretend it to be. And in fact, one of the things that I have been talking about is what I call real transparency. Because I think that every physician, and by the way, that is the definition of physician, it's physician. Other providers are anything but physicians. And in HR 3200, nurse practitioners would be on an equal keel to physicians. I don't believe that that's appropriate. So I'm talking about physician prices, where we quote and post and publish what we charge for our care, where every hospital posts what they charge for their care, and I mean cost, legitimate cost. My hospital has done that, $96 for a mammogram, $250 to $300 for an MRI. They will give you the absolute cost in cash to patients. Now, I'm not suggesting that that is cheap and that everyone can afford it, but at least we start to talk about the legitimate cost of care, because what we're hearing is cost. Nobody knows what that says. That's what doctors want. Patients are thrilled by the opportunity. We believe LACMA passed, and by the way, the AMA passed, and yours truly was at the center of this, as a primary advocacy position, that patients should have the right to privately contract with their physician regardless of their insurance, Medicare, Medicaid, whatever. And we should work for our patients. And darn it, if we don't do a good job, they should go elsewhere. But wouldn't it be nice if we get paid because we're the best? Because the guy down the street wants to be better than me, which only makes me be better than him again. To get back to what I believe is quality health care, and that is health care that is judged by our patients. Did we sell them what they came to the office to get? Not did we fill out a form. It is not about mammograms. It is not about pap smears. It's about, did we serve the patient? And that's where the judge of quality is. And when I asked if you're scared, did you see who's going to be rating quality? The government. What do they know about whether you served your patient in your office, in a room with 4 walls and a closed door? They don't have a clue, nor should they. Now further, and I'll get to your question in 1 second, and I'm hoping that I'll get some questions and some interest here, and you can feel free to disagree with me. But one of the things that was first on the list, which came out of the stimulus package, was that we must prescribe to e-prescribing. Do you know that your patient's prescriptions are sold as soon as it's received by the pharmacy? I don't charge insurance, but when I write my patient a prescription for Januvia, because they're a pre-diabetic and I want to prevent them from ever getting diabetes, they get flyers from all over the country wanting to know if they want to buy an Accu-Check machine. How did that happen? The pharmacy, SureScripts particularly, sells their prescriptions. HIPAA, and I'm embarrassed to tell you I've actually read all these things, HIPAA is about a covered entity. A covered entity is anyone who sells anything to your patients, anything. A foot massager could be a company that sells foot massagers can be a covered entity. They have the privilege of having your patient's information. They get it, and then they send your patient a flyer. As soon as you write your prescription, that information is out and about, and your patient's privacy has been abrogated. That is not the oath we took. That is not the oath we took. I think this is more than troubling. I have an electronic medical record in my office. I've gone through all the decreased productivity that it's really involved in. I will tell you that the data shows that CPOE actually increases errors, not decreases errors. It's true. Now, that doesn't mean that we can't have electronic medical records. But is that so that you can track your patient's real medical record? Or is the purpose of that so you can give data to the government? And those quality standards that you will have to play to in order to get any of that money back means that you have to exchange data with the government. I'll exchange data with any physician who wants to take care of my patient, provided that my patient gives me permission. But does the government deserve to know how many patients you have in your practice with diabetes? And how many patients in your practice with diabetes are treated the same? The answer is none. So even though they may bear the diagnosis diabetes, and it would be important to know that, I would suggest that it's more important that we spend time treating the individual patient rather than coming up with lists of how many of our patients have what disease and letting the government know. I will also tell you a couple of other things that weren't mentioned. HR 3200, 56 different task forces and committees, all assigned to tell you how to take care of your patients. 15 to 30 members of the committee, all assigned by the Director of Health Services, at this time Catherine Sebelius, who was a lobbyist for the trial lawyers. All to be dictating what you do in your office. This is what is before us. Now, questions, comments, stand up, say something.